If you can't measure it, you can't budget for it. If your market research that you utilize to understand the implications and the impact of your patient advocacy function doesn't cover all of the different domains that your team is responsible for, what are you really buying? Aren't you flying blind? I challenge you to go broader and wider. We've been running the Elavay Report for 11 years. And in that time, we've been expanding the domains that we measure to ensure that they are in alignment with the work that your typical patient advocacy function in the industry is up and responsible for. For the last 11 years, we've always been expanding the domains that we're measuring to truly align with the modern patient advocacy function's responsibilities. To date, our main measures have always been on policy and programmatic support, those two, corporate reputation, which is a big metric, but it's only one metric. So, policy support, programmatic support, corporate reputation, expanding access and education, and corporate relationships. That is the relationships between the patient advocacy function and your customers as patient advocates, professional societies, and community based organizations. Those are the five main domains. And for the last 3 years, we've expanded from that as the patient advocacy function has expanded. We now include metrics like diversity, equity, and inclusion, in which many organizations have put the patient engagement functionality or early engagement in drug development under that bucket. We have health equity and which organizations are doing the most to drive the perception of health equity and the education around health equity. And then lastly, we have social determinants of health. All of those domains are evaluated on an annual basis to allow us to understand where your team ranks, what the recommendations and desires are of your customers, what you can do better, what you're doing great, and how your company can better understand what that means to your customer at the end of the day. If you can't measure it, you can't budget for it. It's vital that the market research you're using to assess the impact of your patient advocacy team addresses all of the domains that your team is functionally responsible for. Otherwise, what are you measuring? Ask for more. Within the Elavay Report for the last 11 years, we've focused on 5 key domains: policy support, programmatic support, corporate reputation, expanding access and education, and lastly, relationships. What are the relationships like between your team and the customers that you have in professional societies, community-based organizations, and patient advocacy organizations? Most recently, over the last 3 years, as the patient advocacy role has expanded, we've added new domains like diversity, equity, and inclusion as teams get involved in early drug development engagement with diverse communities. Health equity, a new domain for the last 3 years as well, coming off the back of COVID, and how we can get a better understanding of how the environment shapes a patient's health. And lastly, social determinants of health, down to the very zip code and the impact that zip code has on a patient's health and what we in industry can do to best serve those patients. May it be transportation issues, food security, housing security, you name it. But we know that if it falls under the domain of patient advocacy, we should be measuring it. We've even gone a step further of including metrics from these very important customers on elements like your programmatic support. We've even expanded over the last year to include important metrics that do not get included in the patient advocacy feedback, but are included in our research overall. We know that this is a vital customer group to get insights from. So why not ask them about your company's patient assistance program? That's exactly what we've done. So there's a ton of data within our report, again, both quantitative and qualitative, because we know that your role has expanded. And if we're not measuring that which you are doing, we can't budget to get you the resources you need to be able to do more or to be able to do it better. Historically, social determinants of health and health equity issues were tackled by alternative teams somewhere within the organization, but not under patient advocacy. The problem with that is most of the time, their metrics were all internal based. What good is that? What are we going to pat ourselves on the back that we had X amount of meetings with patients, or we had X amount of diverse representation in our clinical trials? Why not get the results or the answers from our customers? especially those that represent the patient base. So that's one of the reasons that we've expanded to include that research. Stop with the internal metrics and go directly to the source who can give you the truth. We've seen this impact organizations time and time again. For example, one of the top two patient advocacy functions in this most recent report historically had always shown incongruency in its health equity versus social determinant of health metrics. What that was telling us, and ultimately what we were telling the company, was that they could walk the walk when it came to educating the community about the issues around health equity. They knew what it was, they could speak to it, they could play a great song and dance, so to speak, around what that company wanted to do when it came to health equity and helping the patient community. But when it came down to the metrics and understanding what the company was doing to address 10 key areas of social determinants of health, that's where the incongruency really showed. They may have looked high on those rankings when we evaluated the perception in health equity. But when it came to the work on the ground alongside patients to address the issues holding patients back from getting access to vital drugs or access to their doctor or getting access to their pharmacy, the rubber wasn't hitting the road. That's where we were able to step in and help guide the organization to have a better understanding of what the expectations were, what actions they could take immediately, and what groups they should pull together to gather even deeper insights on how their specific patient populations were being impacted by social determinants of health and what the organization could do to not only help patients overcome that, but in the end, drive to the bottom line success. Again, if a patient can't get to the doctor or identify a specialist or get to the pharmacy to get that prescription filled that their doctor prescribed them, what good is your product? That's where advocacy can step in. And that's what we're able to provide in our measurement. I'll also point to an organization 2 years ago in the diabetes med device space. This team was not responsible for health equity. They were not responsible for social determinants of health. They had a third-party team within their own organization, part of the executive leadership team that was, again, reporting back into the executive leadership team on the opportunities, so to speak, in health equity. Unfortunately, what we recognized was this team's focus had nothing to do with the organization itself. This is a company that's focused on type 1 and type 2 diabetes, but the health equity team was focused on maternal diabetes or gestational diabetes. Doesn't fly long term to spend money where your company is not. So what we sought to understand was what's the perception of this company's customers in patient advocacy, professional societies, and community-based organizations on the health equity and social determinant of health issues impacting the type 1 and type 2 diabetics. And man, did they show up. The resources that were desired, the inputs that were necessary, the funding needs, all of it came to light. And as you might imagine, some of the big social determinant of health issues like access to healthy food or access to a specialist or transportation or even technology education. Shoot, if you're getting, let's say, a continuous glucose monitor that hooks to your phone so that you can measure your glucose in real time, but you don't know how to use a cell phone, what good is that? That's the report. That's what Elavay provides you. And more importantly, for this particular organization, it showed the executive leadership team that health equity should not sit outside of patient advocacy. It should be a part of the patient advocacy remit. And this team took it on and had amazing results with their opportunity to engage with their local customers, to engage with boots on the ground, to engage with the patients, and address those issues patient by patient, group by group, and ensure that the solutions that were necessary were solutions that were both created and provided. Even more so, they were able to get executive leadership team appropriation and alignment, meaning an executive leadership team member for either health equity or social determinants of health or diversity. Whoever that team member was on the executive leadership team whose responsibility it was to oversee that issue. We're working alongside of the patient advocacy function week after week after week. And whatever needs they had, whatever resource constraints what they may have had, whatever budgeting constraints they had, could be immediately addressed because they could go right back to the executive leadership team where all budgets were housed and get what they needed to drive an impact for that patient community. Better yet, the Elavay report provided that qualitative and quantitative feedback and showed over a 2-year period, this team go from mid-pack, around 6 or 7, all the way as high as number 1 2 years later in health equity and social determinants of health. That's the impact of measuring your effectiveness and your impact in all of the domains that you cover. Otherwise, why should your team or your organization give you the budget in the first place? If you can't report back on what's been done with those dollars, how it was received by your customers in the field, and more importantly, what you're going to do next. Why do it at all? That's the power of Elavay.